Welcome to the Flex Forward podcast, where grit meets growth. With your host, Nic Espanet, bringing you stories of resilience, reinvention, and the real climb to success.
All right, everyone, welcome to the Flex Forward podcast. Today, we're joined by Kimberly Denney. Kimberly is a Senior VP and GM of MediMaps. I'm going to let her give you a little more detail about that. Kimberly, we're so glad to have you here on the Flex Forward podcast. Can you let our listeners know a little bit more about you and about MediMaps?
Sure, I'll be happy to, Nick. And thanks again for inviting me on your podcast and making this available to your listeners. So as you shared, I work for a medical software as a medical device company whose global headquarters are in Switzerland, in Geneva. And I'm responsible for the US commercial operations. And we've been scaling that business here in the US. I'm based in the North Austin area in Georgetown. I have a couple of the employees here. We're all remote, so I have some in other parts of the US. But we do hope to open an office in the Austin area probably within the next 2 years and make this the US home base for MediMaps Group. So as a software as a medical device, we're in the musculoskeletal space in imaging. So currently our product is integrated into DEXA machines, which do the bone density scanning. Mm-hmm. And without our software, the result that a patient gets tells them how much quantity of bone they have. That's what bone mineral density is. Our software adds another factor to that, which is looking at the quality of bone that a patient has. And the real definition for osteoporosis is a combination of bone density and bone quality. So you can have good bone mass, but if the quality has started to deteriorate, you could be at a very high risk for a fracture. And in fact, osteoporosis is a bit of an epidemic in the United States. Almost 1 in 2 women will have a fragility fracture.
Oh, wow. 50%.
Over the age of 50.
Yeah. Wow.
Yes. And 1 in 4 men. And this is being driven by a number of factors, not just aging, but the disease in our population as it relates to diabetes and metabolic disorders, anti-inflammatory conditions, cancer treatments. There's a variety of things that impact bone health. So our software has been cleared by the FDA to help identify those patients that are at a very high risk for a fragility fracture from both primary, the aging-related osteoporosis, and the secondary causes of osteoporosis. And then the software helps physicians to really help identify the best therapeutic agents if a patient gets identified as having osteoporosis, and to help them monitor the progress on an agent over time by continuing to rescan them with this software.
To see if they're improving. Yeah, improving or getting worse.
Yeah, so that's been our flagship product today. We have about 1,700 installations in the US. Both DEXA scanners that are sold in the US from 2 companies. One's General Electric, GE, and the other is Hologic. They both integrate fully with our software and our business partners of ours in the US market. So we're great partners with those organizations. We have been since 2014 in the US when we first got our clearance. But we're on this great trajectory for growth now. We launched a new advanced form of our solution last summer. And right now we're in the window for FDA clearance on a new technology that's full AI that's going to go upstream of where we are today. So the big challenge with osteoporosis is that 70% of the people that are at risk for a fracture are never screened at all.
Till they have the fracture, probably, right?
Yes. So they end up with a fracture, and then it's found out that, oh, yeah, you actually had poor bone quality and poor bone density. And that fracture is, in some cases, life-ending. It can be life-altering. It carries huge costs. In fact, the cost in the U.S. to manage fractures, now it exceeds the total costs for heart attacks, stroke, and cancer care combined for breast cancer.
Wow.
It's a major cost.
Yeah, I guess I still am a physical therapist. But before I got into commercial real estate, I've got my physical therapy degree, but and might butcher this stat, but like 3/4 of the people over 60 or 70 that have a fracture never return to their prior level of function. Doesn't mean they die. Yeah. They don't. I mean, they're still, but they can never get back to same level of caring for themselves. So trying to prevent those. one, the falls early on, but even keeping their bones strong, which I think unfortunately people find out when they've had the fall where they may have needed to find out in their 50s or 60s or maybe 20s or 30. Who knows when you can detect that it's you start
Yes.
making, dietary or just, and I think something that's from the PT side is activity because it doesn't that strengthen your bone just having weight bearing
Sure.
and the
Weight
pounding and
bearing,
yeah.
weight bearing specifically, yeah. So heavy weight loading on the skeletal spine is certainly important, but diet and nutrition are equally important. And then
Hmm.
unfortunately, there are the use of certain chronic medications that just rob the bone of its health and
Hmm.
integrity. But you were talking about the age, and exciting also for our company later this year, we expect an indication for a pediatric use of our
Oh,
product
wow.
because sadly, of course, there are conditions in pediatrics that impact bone health. And so to be able to monitor those children and, help them to get back to better bone health is essential. And that
Definitely.
statistic that you mentioned is exactly right. And scarier still is the fact it's a well-known statistic that if you're over the age of 65 and you break your hip, which is a major osteoporotic fracture, you
Hmm.
have a 25 to 30% likelihood of dying within a year. It's all cause mortality.
Yeah, no, it just really, I remember thinking about it's like not the straw that broke the camel's back, but you're putting a big bell of straw up there that's going to really, may not break the back, but it's going to make the load so much heavier over the next months or years. So, yeah, if you can prevent falls and fractures just through one balance, but also bone health and bone strength, so it's great, you guys, and maybe one if they could start testing earlier to start giving people the
Yes.
mindset to start either they're through activity, improving their diet, or changing some medicines up to help keep these bones strong. That
Yes.
preventative screening would be wonderful.
Right. And particularly in, younger women, knowing that coming out of menopause, that's kind of the natural progression for bone loss. And US kind of standard guidelines tends to only look at women coming into Medicare at age 65 and looking at their bone screening, but they may have been osteopenic, meaning they've already had some bone loss for many, many years. And there are therapeutic agents today that build bone back. And so, why we're not preventatively
Starting early.
looking at women early in their 30s or 40s who have certain risk factors and getting ahead of that curve as opposed to, waiting for this just continued epidemic that we're dealing with fragility
Definitely.
fractures.
Yeah, no, it's very exciting what you guys are working on, and I hope it keeps growing and people, starts preventing not only preventing falls and fractures, but helping improve quality of life for people for for their senior year ages. It's awful. I mean, when I did physical therapy, I worked with geriatrics a lot. So you'd see people after those falls and they get to where their only activities going to the restroom or to the kitchen to eat. You're like, you want to keep a quality of life if you're going to have that long life too.
Exactly. I mean, when the elderly lose their independence, or when they go from being, mobile on their feet to being, in a wheelchair, that quality of life, deteriorates rapidly. And I actually went through that experience with my own mother who had a
Mm.
fall, and then she wasn't able to continue to walk, and she had some dementia, which that whole experience of being hospitalized, in and out multiple times accelerated that. So
Sure.
unfortunately, very sadly, within 90 days of her fall, she passed away.
I'm
Um,
sorry to hear
and
that.
it's not, I mean, I hear this frequently from other people that have gone through the same thing with a parent or a loved one.
Yeah, and I was in home health for 10 years, so I saw what's we would see that pretty often. You just kind of starts the domino gets knocked over, and then they start kind of just following along there.
Yeah, well, and there's a combination of factors there. So it's not just the bone fragility, but if you lose that physicality from a fall or fracture, then you lose muscle mass, the sarcopenia. And
Yeah.
it's the combination of those. Like it's so hard to maintain your muscle mass as you're aging.
Well, and I think I've read something too that after a certain age, almost like your bank account, it's hard to put money in after a certain age. So you got to build the muscle. I'm in my 50s and really started focusing more on instead of cardiovascular stuff, more lifting and trying to build
Yes.
build muscle to build up my bank account before I hit that age where I can't add any more into it. So sounds like things are going well. And what, as you've grown, what is
Mhm.
something that sets you apart from other people that may be pursuing some of the same avenues?
Well, for one thing, I think we are so grounded as a company in the science of bone health, and that's really a tribute to our CEO and co-founder. His name is Professor Didier Hans, and he's actually still the active chair of bone health and mineral research at a teaching hospital in Lausanne, Switzerland. So his whole career has been in this space, dedicated to this. And as a result of developing the technology within MediMaps, we have 7 patents around this technology. We are the only organization that provides this trabecular bone score algorithm for assessing fragility fractures. And we've been identified as an independent parameter for identifying that risk of fracture. I mean, the closest way that you could get to doing what we do is a patient could have a bone biopsy, which is painful and invasive,
Mm-hmm.
or they could have a quantitative CT exam, which is highly radiating. Or they can just have their bone mineral density exam without any additional scan time or any additional radiation, receive the trabecular bone score analysis combined with their bone mineral density exam. So it's really, the company's done an amazing job of building out this niche and, surrounding the moat with, even greater, fortresses and protection, and then leveraging that as a ground truth to build out our next forthcoming products.
That's awesome. And the DEX scan is very not invasive at all. Isn't it a heel? You put something on your heel, if I remember correctly, or
No,
my
that is an older technology that was
okay.
out there, but this is you lay on a table basically,
Okay.
and it's an X-ray based exam, and it's in
Okay.
most imaging centers, so outpatient or inpatient. For women, a lot of locations that are doing breast imaging will have a DEXA system as well.
Okay. So, as you've journeyed, you've probably found things that help improve how you're doing things. I know if you've read Dr. Peter Tia's books, you're into some health improvement. So, what if someone's listening and wants to, you want some tips on things that help you get better? What's something you might share with them? Podcasts or books or
Oh,
things that you've
yeah.
read?
Absolutely. Well, I'm a massively avid reader, and I loved hearing about your book club. And I watch podcasts as opposed to like watching other things on Netflix. I think staying curious. And
Oh yeah.
a year or so ago, I started dabbling with all of the various AI tools to understand how they might support my workflow. I was doing consulting work before jumping into this role with MediMaps. And I've been surprised sometimes interacting with younger employees who haven't leaned into those tools yet. I would advise people to always be learning, be curious, test their assumptions, build their networks, step out of their comfort zone, because that's where real learning happens.
No, that's so awesome. So, what's one of the biggest challenges you've had to overcome in your career?
Oh, biggest challenges I've had to overcome in my career. I've been so blessed to have an amazing career that has spanned medical devices, implantable devices to enterprise software. I think sometimes the challenges came extraneously, like during COVID or, family situations like needing to lean in to help with my mother's care
Hmm.
created an interruption in my career. But I think in terms of navigating like the corporate world, I would say learning to be proactive in your role. Today, sometimes we see, well, there's a lot going on in people's lives, but sometimes we see employees who kind of kind of do enough, but aren't
Hmm.
really thinking about what else can they bring to that role in terms of their creativity and their ideas. And I remember just a book that I had read years ago. I don't know if you ever read anything by Seth Godin, but he wrote a book called Linchpin. And it was really impactful for me because it was about being that linchpin in your organization who connects peoples and ideas and who leans into things, who sticks their hand up and volunteers, and I became that kind of an employee during my career, and it accelerated my career. And I kind of got recognized for going above and beyond, and somebody that could be counted upon, even when I didn't really know what I was doing. I just took the risk to do it and learn from it.
And that's awesome. I think that's such a good example. As Linchpin, I wrote down that book. I want to read it. I've heard Seth Godin, but I don't know that I've ever read any of his books. But it's stepping up, being the one that volunteers, even if it's, you don't have to just volunteer like, oh, I'm going to get extra pay, but let your company or even your investors, whatever it is you're doing, know that you're there that you're going to go the extra mile and be willing to do the extra work if needed. It really, people notice that.
They do. They do. And I think it's a great skill to build and to add to your repertoire.
For sure. So Kimberly, it sounds like things are going really well for you and your business. And a lot of people, as they start having success, start looking towards, different ways they may create passive income or have something that, doesn't necessarily need your time and looking out to the future, either to replace current income or supplement. What are your thoughts on different types of passive income?
Oh, wow. Yeah, that's interesting. In the past, I don't think the income that I generated on the side was so passive, because I engaged in consulting work. So I took on consulting projects in the healthcare technology space. I also taught as an adjunct professor for a few different colleges, which was asynchronous work. So, online education today, students do their work and it's graded. And they have a certain period of time to get it in. So you can respond to them at night or on the weekends. And it makes for a good adjunctive area for additional compensation if you're inclined to teach at the graduate or undergraduate level. But I haven't really, found that true passive thing that you can just turn on and leave alone and it generates money. If you have the secret to that, I would love that.
Yeah, I think we're all looking for something along those lines. So as we're wrapping up, do you have any exciting plans or initiatives in the next 6 to 12 months?
Well, right now we're from a work standpoint, we're definitely planning for our product launches. So we're looking towards April for that AI driven launch that's going to get us out to that population that's never screened for that risk. So it's going to be a real game changer for us. On a personal level, I'm looking forward to a beach vacation in May with my husband. We love to go to Sarasota and enjoy the beaches after they get a little quieter after the Easter crowd goes home.
Sure.
So yeah, that's what I'm looking forward to.
That's awesome. Thank you so much. So, thank you so much for your time and sharing some tips and insights with our listeners. If people would like to connect with you and learn more about you and what you do, what's the best way for them to get in touch with you?
Yeah, I think the easiest way is on LinkedIn. I've always been very active there. I think that's how you all reached out to me was through LinkedIn. So it's Kimberly Denney, and I should be easily found under MediMaps.
Awesome. Well, thank you so much, Kimberly. I've really enjoyed getting to know you and more about what MediMaps does. I think you guys are going to do just really help people a lot. And once it's accepted and, just improve the quality of life for a lot of people. So that's exciting to learn about.
Yeah, that's our mission, an era where healthy bones are the norm.
Awesome. Well, thank you. Thanks everyone for listening. Be sure to like and share and pass this along to your friends who may also enjoy it. Thanks everyone. Thank you, Kimberly.
Thank you, Nick.
Thanks for listening to the Flex Forward podcast. If you've got grit, growth, and a great story, visit flexforwardpodcast.com/guest to apply and join us on the show.